The hormones that regulate the functioning of reproductive system in both males and females are produced by the brain and the sex glands. So in the brain, it's hypothalamus and anterior pituitary, and sex glands, ovaries, and testes. So hypothalamus releases factors that regulate production of a follicle-stimulating hormone and luteinizing hormone by the anterior pituitary. And so pituitary releases these hormones, and follicle-stimulating hormone stimulates development of eggs and follicles in the female reproductive system and ovaries, as you can guess from its name. But it also works in males, and in males, it stimulates production of sperm in the testes. Luteinizing hormone stimulates ovulation and secretion of progesterone and estrogen by corpus luteum. In the case of pregnancy, so it supports the pregnancy, and in males, it stimulates the production of testosterone. Ovaries and testes produce sex hormones. Androgens, which are male hormones, and estrogens, female hormones, and another female hormone is progesterone. It is a misconception to think that males only produce androgens and females only produce female sex hormones. Actually, both sexes produce all types of hormones, only in different amounts, and these hormones act differently. Same hormone acts differently in males and females. So sex hormones regulate the development of primary sex characteristics during embryogenesis, and primary sex characteristics is actually the glands, testes or ovaries. Also, they regulate the development of secondary sex characteristics, puberty, and then sexual behavior and sex drive. The major male sex hormone is testosterone, and its effect, as a sex hormone, it promotes the development of male reproductive tissue, maintains its functioning, stimulates spermatogenesis, and regulates the development of secondary sex characteristics in male, such as genitals, also the other characteristics that the features of men, such as more body hair, low voice, heavier build. This hormone also maintains the libido, the sexual drive, and is believed to be involved in behaviors that are considered to be typical in male, as aggression, dominance, or courtship. It also stimulates muscle and bone growth and has an effect on overall mood and social sexual behavior. In women, the male sex hormone is estrogen, and actually the other one is progesterone. So estrogens, it's several hormones, and they also play an important role in the development and regulation, but now of female reproductive system. They stimulate bone and muscle growth, and that's why after the menopause, actually women, the level of estrogens go down, and women lose some bone mass and develop osteoporosis. So these hormones also maintain secondary sex characteristics of women. It affects the sexual drive through the central nervous system, and just supports the reproductive system of a woman. Progesterone is a key hormone during pregnancy and during regulation of the menstrual cycle. It's also interesting that the reproductive cycle of women is a combination of two cycles, ovarian and menstrual, because the reproductive cycle involves first production of eggs, but then the body has to be prepared to accept this egg and to grow it and to develop it. So the ovarian cycle is what happens in the ovaries with the release of the eggs, and menstrual cycle is what happens in the uterus to prepare for the embryo to implant and develop in the uterus. The reproductive cycle is about 28 days. It's counted from the first day of menstruation. From the beginning of the cycle, the level of hormones of estrogen and progesterone increases, and this causes the ovulation. Ovulation happens approximately in the middle of the reproductive cycle on day 14. I mean, it depends on the woman, but in general, it's like middle of the reproductive cycle. If the fertilization happened, the embryo travels to the uterus and implants into the lining of the uterus. But if the fertilization didn't happen, the lining of the uterus is like sloughs off during menstruation, because when this happens, the uterine arteries are damaged and they start to bleed. So if we look at what's happening in the uterus, so to prepare for the embryo, the lining of the uterus becomes thicker and very well supplied with the blood. So when the embryo comes, it can incorporate itself into the lining, and it will be well provided with the nutrients and gases, and it can develop successfully. This didn't happen. There were no fertilization. The lining of the uterus is washed off during the menstruation. And then the whole cycle starts again in hope that, okay, there will be new ovulation, new months, new ovulation, and maybe the fertilization will happen and the pregnancy will happen. Another interesting feature of humans that this cycle repeats about like 400, maybe 500 times during the reproductive period of a woman, starting from puberty and till the menopause. Menopause is when the woman stops to ovulate and stops to menstruate at about the age about like 50, 52, 54 years old. And this is very unusual among animals. Very few animals have menopause. Usually the female animal gives birth till death. So the meaning of menopause wasn't really clear, because, I mean, of course, we are all valuable as persons, but from the evolutionary point of view, if the woman doesn't give birth to children, she becomes useless. But not in the case of humans, because humans are social creatures. And there is the theory that's called grandmother theory that explains why women do not lose their value after the menopause, and not even the evolutionary value, because we live in the society, and instead of giving birth and like wearing herself to nothing, because carrying child is an ordeal, it's very difficult, and it definitely affects women's health. So instead of killing herself with pregnancy, she would be much more useful just by taking care of her daughters or her grandchildren. And surprisingly, the menopause is observed in orcas, on the killer whales. And killer whales also social animals, and grandmothers help the younger generations to raise their children, almost like humans do. It used to be a kind of scientific question: do men have menopause? Or it's called andropause in humans, in males. So they do. They still continue to produce sperm, but the reproductive function declines between the ages of 50 and 60. So the levels of testosterone decrease, and sexual activity, sexual drive decreases. And it used to be suggestion, and it's like some people still do it, the androgen therapy. So the same as in women, when women have declining levels of estrogen, they're prescribed estrogens, and males can be prescribed androgen, like testosterone. But it remains controversial, and one of the reasons is that, yes, it makes males more virile, and they still continue to be sexually active, but very many males develop prostate cancer. And prostate cancer is much more common thing that you would think. a lot of males, like older males, old men, have prostate cancer, but in most cases, the prostate cancer is a very slow cancer. So usually the person dies of old age much before the cancer actually destroys the prostate. So there were some cases when the men who were taking androgens, in their case, the prostate cancer was very much accelerated. I mean, there are some aggressive and rapidly developing forms of prostate cancer, but if it's a slow version, it can be pushed, it can be accelerated by the androgens. So I don't know what's better, to lose the sex drive or to die from cancer. I would probably prefer the first one. Okay, then we'll talk about the development.